it's Katherine Ashmore and welcome to the Mindset Exchange podcast. Today's episode is all about sleep and I'm honoured to be interviewing the renowned Dr. Michelle, a very qualified and experienced sleep expert. You're going to want to listen on this, especially if you're a high achiever, and here's why. This episode will debunk so many myths about sleep, insomnia and sleep deprivation. Just when is the best time to sleep? Does caffeine or blue light have an impact? What about stress and anxiety? How do you get the best sleep to ensure better productivity, better creativity and decision making? And how does it impact your mindset? This had to be the second episode to help all of us with easy, low-effort tips and tools that we can all do to ensure that we have the best start to the day. Keep on listening. Here goes. Hi everyone and welcome to today's episode and a very warm welcome to sleep specialist Dr. Michelle. Hi Michelle, thank you for being here.
Hi Katherine, thank you so much for having me. Delighted to be here
I'm
with you.
really excited about this one. This is going to be our very first episode on the podcast apart from my introduction. And today's episode we're going to be discussing one of the main foundations of a healthy mindset, which is sleep. Before we start, Michelle, can you share a bit about yourself for the listeners, please?
Sure. So my name's Dr. Michelle and I run a private practice looking after people who have insomnia. And my main form of helping people with insomnia is through the evidence-based treatment known as cognitive behavioural therapy for insomnia. So this is what I have been specialising in recent years, but actually my background is actually as a neuroscientist. So for it's about almost 20 years in total, First of all, I did a PhD in cognitive neuroscience in Trinity College Dublin, and then I moved to London and I was working as a scientist in UCL and Great Ormond Street Hospital. So I was running clinical trials on young babies and children with different kinds of disorders. And so it was like part of my time was face-to-face with the babies and children, but then the other part was really data analysis and delving into the statistics and evidence. But I reached a point then when I had the opportunity to learn how to do insomnia therapy, and I was so fascinated for many reasons, but one of the key ones, kind of from a selfish point of view, is that I'm a former insomnia sufferer myself. So I wanted to really learn so I could apply it to myself, and actually it's just made such a huge difference to my life. So I really want to share that with people going forward to help them. So yes.
Oh, thank you. And it's very interesting that transition from specialising in neuroscience to then insomnia, but actually they're quite related, aren't they?
Yes, absolutely. So I suppose one part of it from my kind of work point of view was that in my work at Great Ormond Street, first of all, the children who had all different kinds of disorders, first of all, I couldn't help but notice they had very severe sleep issues. But then also beyond that, in terms of their family and their parents around them, their parents were hugely affected by sleep loss. And I really felt this was a perhaps under-recognised issue and was contributing so much to both their illness and their quality of life. So there's such a huge, there's nothing, in terms of neuroscience and psychology that sleep isn't related to. It just kind of permeates every single facet ultimately. Yeah. So I found that such a fascinating thing. It was such a crux at the centre of everything.
It really is the foundation, isn't it, of our mindset?
Completely. Yeah. Yes, it's so enormous. And I think we all know, the impact it has on our mindset from the minute we open our eyes in the morning, that if you've had a bad night's sleep, your mindset is so completely different to, when you contrast that when you do get a good night's sleep and you feel like you can take on the world. I think we all know that feeling.
Yeah, we do. Speaking for myself. So if we're thinking about sleep, I think, before you came on, I was thinking about, the difference between insomnia and interrupted sleep. And I thought, actually, I think there's quite a lot of confusion around that area. around the
Yeah,
distinctions around sleep. What is sleep deprivation? What is
absolutely.
insomnia? What is sleep interruption? Would you mind talking a bit about that, please?
Sure. Yeah, that's so spot on, Catherine. Yeah, and I feel this is something that's so currently kind of under recognized out there, but it's so important because it's having such an impact on people. So, there's so much, I think it's fantastic. There's so much awareness of sleep out there in recent years, but I think, ultimately there's kind of a lack of distinction made between the different kinds of sleep loss. So sleep tends to get lumped all together under the one umbrella, but there's actually very different types of sleep loss essentially, and they have very different processes and therefore they're very different consequences for. So say if I just explain, say, the difference between insomnia and sleep deprivation, because I think there's a lot of that doesn't really get teased out, in terms of what they mean and the differences. So with chronic insomnia, essentially that means you have the opportunity to sleep. You might have a nice uninterrupted 7-8 hour window with no interruptions, but we don't have the ability to sleep. And this is something that's happening in a predictable way, and it happens perhaps night after night into the long term. And because it's happening night after night, it's something from a systems or physiology point of view. The good news with insomnia, as awful as it is, our physiology learns to adapt to it because of this repetitive nature of this, of chronic insomnia. And with that adaptation, actually that has very different consequences for us in terms of the health consequences. But say if I contrast that with sleep deprivation is exactly the reversal. So it's where you have the ability to sleep, but you don't have the opportunity to sleep. So say the neighbour's dog is barking or the baby is crying, or perhaps there's an illness that's waking you up in the middle of the night. So these are external factors that are causing that sleep loss compared to something internal like insomnia disorder. So with sleep deprivation, we all know that's the form of torture, but it's the external way in which it comes about. Because of that, it isn't predictable, and when it isn't predictable physiologically, we can't get used to it, and that's why that's the more damaging form of sleep loss. But what I really see is, in so many of my patients, is that there's such understandable anxiety when the two things tend to get lumped together, which I do understand, but unfortunately that's causing, not only is it, it's an important distinction, but it's almost fueling insomnia out there because it's generating so much anxiety about our sleep. And yeah, I really feel for people who are so concerned about that. I mean, of course it's incredibly important, but when it goes too far, it just backfires and it heaps pressure on our sleep and makes sleep all the more elusive.
Yeah, that's sort of overthinking as well.
Exactly.
Yeah.
Yeah, overthinking, that's probably the single biggest contributor to chronic insomnia for sure.
And thinking about chronic insomnia, are there any myths or misconceptions about insomnia that you'd like to address?
I suppose kind of related to what I mentioned there in terms of that distinction and how we adapt to the different forms of sleep loss. One thing is that I think there are a lot of scary headlines out there about the impact of sleep loss on our health. In terms of when we see all these scary headlines, such as that we're going to die young, for example, when we have insomnia, that gets stated in the media quite frequently in recent years. But actually, that isn't true. So it's really, in that case, if you delve into the studies that are being reported, if you actually, go through them, it's actually sleep deprivation that is talked about, is actually being researched in that context rather than insomnia. So there's actually no evidence behind that, which I hope is good news and reassuring to people, because that's, in terms of that physiological adaptation that we make in the context of chronic insomnia, it actually means it's not as damaging. Chronic insomnia is not as damaging to our health as sleep deprivation is. Okay, so I think it's good to, really make that clear.
Because I know I myself have read in the press that, not only that it leads to early death, but it can lead to dementia or Alzheimer's. And that can be quite, I imagine, if one is going through a lot of sleep interruption or insomnia, that can be quite scary.
I know. Yeah, that's incredibly scary. And that's something that patients who come to me is one of the first things that they talk about as one of their fears and actually reason for coming to me. But in reality, this data, this claim about dementia isn't conclusive at this point in time. We really do need more conclusive evidence behind that. And really, in terms of the studies, it needs to be more clear, are they speaking about those who are suffering from sleep deprivation, or is it actually insomnia? And are they actually separating the two? And perhaps another issue to look out for is there can also be other kinds of sleep disorders. There's so many different kinds of sleep disorders out there, and they can get lumped together. And so to tease these things out is really important, but it isn't necessarily the case. We know sleep, of course, is so important for our memory, but it may be the case that with this adaptation, it might not be as catastrophic as in the case of the likes of sleep deprivation. So I would like to some extent set people's minds at rest. There's enough, it's already such a horrible thing to go through. And I think, that additional level of worry when we're just not quite sure yet isn't helpful at all.
Thank you for explaining that. And I was just also thinking about, there's a lot either online or even in some of the medical guidance where they set out a prescribed amount of hours that you're supposed to sleep every day. Now, some people naturally just don't seem to need much sleep. They might wake up early, they might go to bed early, and also it depends what stage they are in their lives, whether hormones come into it or not. So, if you're someone who's never really had or needed that many hours sleep, thinking about what you were saying just there about the physiological adjustment, does it matter?
Yeah, I mean the issue of our sleep duration, it's really the key thing is how it's such an individual thing. It really, really is. And, ultimately it boils down to the number of hours of sleep we need is ultimately it's set by our genetics. So that just essentially tells us that's going to be really very different for each individual. And, I think we've all seen the issue of we need to be sleeping for 8 hours a night. That is another slightly problematic concept that's out there, unfortunately, because amongst people who might tend to be worried about their sleep, that just makes anxiety worse. But not only that, it isn't necessarily accurate anyway because of this. It's so different. Our sleep need is different from person to person. And one analogy could be something like, say us going into a shoe shop and we're all supposed to fit into size 7 shoes, but of course, we're all different. But if we're all forced to fit into the same size shoes, it just isn't going to be a very good experience. So there's just so much variation. There are some people who, as you say, Catherine, they feel, they get say 5 hours sleep and they actually feel fantastic on that. So the key thing is really how the person is feeling during the day. That's the most important thing, really. But then there's other people who, might feel horrendous unless they get 12 hours sleep. So it's really massively different from person to person. And of course, other factors like you mentioned, like since age or hormonal changes and things like that. So it's absolutely different for each individual and different for, each year of their life. There's, huge variation there.
And thank goodness that we're all different, eh? So thinking about the main profiles that get insomnia, we were talking out of the podcast for a bit before, weren't we? And you mentioned that actually, interestingly, high achievers are one of the
Mm,
main profiles that get insomnia. Can you talk me through
definitely.
that, please, Michelle?
Sure, absolutely. So yeah, this has been something I have been so struck by in terms of the people who are seeking help. So yeah, I've really noticed that they, are very, very demanding
Hmm.
careers and jobs. So, of course, it's natural that there would be a demand in terms of they want to perform at their best and therefore they're interested in their sleep. Um, but almost beyond that, I noticed that, one thing about sleep and insomnia is that it's something that can be perhaps fueled by an over focus on your sleep and a desire to control your sleep and to really perhaps put the same framework that they would have on the rest of their lives onto sleep. But sleep, as I often say to my clients, is something that it becomes so elusive when we try to control it. So I actually use a quote by Viktor Frankl, who's a psychiatrist and psychologist who's a Holocaust survivor, an amazing man. But he has this beautiful quote about sleep where he says that sleep is like a dove that comes and lands here in my hand and stays there as long as I don't pay any attention to it. So if I turn towards the dove or turn towards my sleep and try to really chase it and try to control it, of course, that dove or that sleep will run away, it'll fly away. From us. But if I just let it stay there and perhaps have my attention onto to other things in my life, then chances are that sleep will be with me. That dove will actually stay with me. But I also, in terms of my clients, I feel like there's almost like a formula or equation that can perhaps be in their lives with their success and high achievement where they might feel the more of X or effort they put into something, the more Y success they receive back.
Hmm.
But sleep is one of the few things in our lives that doesn't really behave in those kind of parameters. And I think that's sort of what's going on ultimately with those high achievers that they feel if I put so much attention, try to fix all these other things in my life, then I get good results. And they try to do the same with their sleep. And
Yeah.
that kind of mindset then, as you know, because you can imagine, does backfire. So yeah,
Hmm.
but yeah, that's also borne out in a lot of the literature. And it's actually known to be one of the predisposing factors. So almost like a level of perfectionism in our lives. And then, of course, there's a strong link between that kind of level of perfectionism, being high achiever, and having insomnia, having that predisposition.
Yeah. So what I'm hearing is really because of, as you said, the skills that they have that they apply in their everyday, it's
Yes,
automatic almost to assume that you can control your sleep. But actually,
100%.
some things are just out of our control. And I just wanted
Exactly.
to touch on that beautiful quote that you said. That's a really beautiful visual picture. And actually, I think will be very helpful to think about it like
Sure.
that, to
Yeah,
not overthink it, but to hold
yeah,
it lightly in the head.
that's right.
Um, and,
Yes.
and talking through from my own personal experience as well, that
Mm,
I sort of fell into two camps. And I think we talked about this, where either there are many who burn the midnight oil and they sacrifice their sleep for their goals,
yes,
or it's about that controlling element.
yes,
And so,
absolutely.
what are the common sleep issues then that these sort of entrepreneurs or high achievers face, would you say?
So yes, with the that other camp in terms of the high achievers and the kind of anxiety about their sleep, I think the sleep issues we see there, it's very varied. So probably the most common one would be difficulty falling asleep because there is this level of that kind of level of anxiety throughout the day, and that actually naturally ramps up at night due to evolutionary biological mechanisms that are still going on to this day for us. But yeah, there is a level of what we know as hyperarousal, like a physiological hyperarousal that's kind of brought on by that level of stress during the day. And when that's really high, it makes it more difficult to fall asleep. But there's also, I do very much see issues with waking during the night as well. So in that case, it might be people who perhaps have no problem falling asleep, but then they just, yeah, wake in the night and then really all those similar factors kick in then essentially and have that struggle to fall back asleep.
And thank you for explaining that. So when you're, I sort of didn't know the actual term, but I call it being wired, where your brain
Exactly.
is sort of like
Yeah,
overthinking all the billions of things that you need to do. And
completely.
so am I right in thinking it's really important to implement sort of relaxing tools at that point before you go to bed?
Definitely.
Um, but if we're thinking
Sure.
about how improved sleep quality enhances creativity or decision making and overall
Yes.
cognitive function for people in high pressure environments. Can you
Mm.
talk a bit about that, please?
Sure. Yes. I mean,
Yeah.
there's such enormous evidence out there in terms of the link between creativity and productivity. And, we know, say, on the reverse side of that, in terms of, when we don't get enough sleep, it's known to cost the US economy. I think the latest numbers is something like $60 billion a year, which is no small number. It also has an impact on the likes of absenteeism and also
Mm.
presenteeism as well. So, you're physically there in work, but not quite fully there at the same time. It's also known to have an impact on our ability to concentrate, which of course feeds in so much into our productivity as well. And I know a lot of my clients, that's one of the key daytime symptoms that they experience is difficulty concentrating. And
Mhm.
yeah, that can really feed into a lot of other issues as well.
Yeah. And if we're thinking about what we talked about earlier about the being overwired or the hyperarousal state, what
Yes.
are factors that can impact that?
Yes, there's so many different factors feeding into that. I guess a key one is really ultimately what's been going on for us during the day, and of course our mindset and our how we respond to things during the daytime and during our work. Lots of other things, even the likes of our exposure to sunlight, actually light during the daytime to set our circadian rhythm, that has a huge impact as well, and on our sleep. Also the likes of even our simple things like hydration has a
Mhm.
big impact, our diet as well, of course. It's such a multifaceted thing. Like they're all like holistically affecting so many other things that, for example, our mindset and our mood, of course, that also indirectly are having an impact on our sleep as well. So all put together, all these kind of lifestyle factors make such a difference. Another one, of course, would be the likes of our beloved coffee. That I do love my coffee, but that can have a huge impact on people's sleep. Again, a bit like, we spoke about the hours of sleep. There's a huge level of individual variation there. I know there's some people who can have an espresso before bed and they sleep wonderfully. But then there's so many other people who do have a much greater sensitivity to caffeine. But
Mhm.
we do clinically advise to leave, to try to cut off your caffeine window, say from about midday onwards, because it does actually have quite a long half life, and that can really have a big
Mm.
impact on that level of hyperarousal and, yeah, lead
Mm.
into issues at night.
Yeah. When we're thinking, you mentioned obviously needing the sunlight during the day and the importance
Yes.
of hydration and diet. Also, some of the things I've read, blue light has an impact as well. Would you agree with that? What time, how many hours before you try to go to sleep do you think you should be off the screens?
Sure. Yeah, that's a really, it's an interesting point. There's a slight bit of controversy in recent times. I know, yeah, I feel like this is something we hear so much about the impact, the negative impact of screens at night. But what I'm seeing more recently is the data that shows that, and from a kind of clinical, real world point of view in adults. So it's a different story when it comes to teenagers. But
Mhm.
in adults, it seems like that perhaps screen time isn't maybe having the huge impact that we perhaps originally thought. When you actually look at in terms of, the delay it takes us to get to sleep,
Mhm.
if we've been exposed to screen time. I forget the exact number, but right now, but it's something it's only like 10 minutes, 12 minutes. So in the grand scheme of things, it doesn't make an enormous difference. But when you set that against the level of perhaps anxiety around screen use, and that anxiety actually, feeding into that need to control our environment, and worry and anxiety that can make our sleep worse. Perhaps in
Yeah.
the grand scheme of things, we don't maybe need to worry about it so much. I think in terms of key concern about screens is actually more the content that we're
Mm.
consuming through that screen, perhaps more
Mhm.
so than the screen itself. So of course the kind of psychological engagement of what we're consuming through social media, and how, addictive it's kind of created to be for us. I think
Mm.
that's more of a problem for sleep rather than, say, the light
Yeah.
from screens
Yeah.
per se. But it's a different issue with teenagers. So there is a
Yeah.
nuance there in terms of the population and the
Yeah.
impact that it's having.
About
Yeah.
how what you actually choose to scroll through can feed
Yes.
anxiety and stress, and one has a personal choice as to who we choose to follow,
Yeah,
as well, and
exactly.
that's not a bad thing to implement, to start being
Absolutely.
mindful about, inform actually sort of controlling what actually is coming into your scrolling.
Completely.
Touching back on what you were saying earlier about stress and anxiety, how
Mm.
does stress and anxiety related to work impact on sleep patterns, and what can be done to manage it?
Sure. So yes, stress and anxiety, it's really has such a huge impact, especially in terms of different hormones, specifically the stress hormone cortisol. And that's something that probably has the key impact, especially in terms of our ability to fall asleep at night, but it's also involved in waking during the night. But actually, a third area is also wakening early. So in terms of, say, anxiety and disorder, that's something that we do see very much so as well. But yeah, it's really playing out at a hormonal, physiological level. And yes, it's a huge, huge issue. But the good
Mm,
news is that we do have techniques that are actually specifically designed to really bring down that level of stress and anxiety. So that
yeah,
at least is the good news here.
that's brilliant, because if we're thinking
Yeah.
about the main profiles that actually getting lack of sleep,
Mm,
and thinking about those high achievers, often they can be in very stressful environments, or in very
absolutely.
managing an awful lot of things at the same time.
Absolutely.
So with that in mind, what treatments and tools would you recommend or use to help people if they
Sure.
do are in these environments and are finding they've got high anxiety or stress relating to work?
Yes. Well, one thing perhaps from a kind of broad perspective first, and then I'll go into more specific techniques and tools. Um, if the person, say, in that kind of environment is, really has sleep issues going on for a period of time, and especially if they feel it's something that's going on with a level of frequency. So say if they're having sleep issues on 3 or more nights a week, and they have that difficulty either getting to sleep or staying asleep or waking too early, and those periods are going on for 30 minutes or longer, that's really indicative of chronic insomnia. And really, the key treatment for that, that's the most evidence based, is what's known as cognitive behavioral therapy for insomnia, is also known as CBTI. And that's basically a multi component structured program where we really bring in lots of different techniques and approaches all put together. So it's kind of a combination of education, going through practical tools and techniques to address, say, the likes of dysfunctional beliefs around our sleep, but also really laying down a good foundation in terms of the person's sleep pattern, working with their own physiological sleep drive, and we work that out using a sleep diary. So it's a kind of a combination of both very practical physiological tools and also psychological tools as well. So it's very, very multifaceted approach. And I think the fact it's so multifaceted just means that it will be all the more effective, and we personalize it to the person as well through an assessment beforehand, because the more bespoke it is, the more unique it is to them and their own lives and circumstances, then the more effective it would be for them. But beyond that, if the person, say, didn't feel they met those kind of criteria for the disorder, but they were struggling anyway, there's lots of different things and small things I would suggest. So from one thing, to go back to speaking about light, I know I was saying perhaps we don't need to necessarily worry too much about light from screens in the evening, but this is particularly the case if we can get bright light in the morning as soon as we can in the morning. That's actually really, really important for our sleep. So say if the person, someone who's very, very busy, if they can even just somehow stick their head outside a window, even for like a couple of minutes each morning, maybe have their tea or coffee standing outside in their garden before they go to work, or even if they just don't have the opportunity to go outside, if they can perhaps put their desk as close to a window as possible. That's something I've learned to do myself, to adapt my space here to what I try to recommend to people. But yeah, I cannot tell you how much evidence there is behind the impact of light on our sleep. And I always notice how I'm struck by how busy I've become when there's very little light in terms of the weather. So when it gets to October time, I suddenly become very busy, and I think that's no coincidence. So I think it's all the harder for us just inevitably in the winter time to get that same exposure, because it's cold and we don't want to go outside. So, but that does have such an impact on us in terms of our melatonin, sleep hormone, so we don't get that same activation. So actually, by getting light onto our, what's known as the retina at the back of the eye, there are receptors that are uniquely sensitive to daylight in particular. And that basically has a neg-timer effect on the what's known as the pineal gland at the back of the brain that releases melatonin 12 hours later. So if we get sunlight, if we get light onto our eyes in the morning, say 10 o'clock in the morning, that means you're going to get that release of melatonin 12 hours later, say 10 o'clock at night, which is exactly when you want it to help you to fall asleep at night. So that's another tip I'd have. Another thing I'd say is to perhaps be wary of extending our time in bed. If we're struggling with our sleep, there's a very completely understandable desire just to try to capture as much sleep as possible, because of course, we're desperate for sleep, and it just feels so like the natural thing to do is to spend more time in bed, maybe to extend it in the morning to, I'll just stay in bed a bit longer and hope to get that bit more sleep. But actually, we really know that this really does backfire, because a subconscious thing kicks in where we form a really powerful association between the bed and being awake. And this is a big driver of chronic insomnia as well. So actually, by doing that, that can really, in the longer term, go against us. Because really what we want is to have a strong, powerful bond between the bed and sleep, of course. So, but by extending our time in bed, say by going to bed even really early before we're tired, and if we're lying there tossing and turning before we're sleepy, that will just, give our brain that message, okay, this is where I feel stressed and this is where I toss and turn, rather than getting the message that this is where I sleep. So that's another big thing as well.
Those are really helpful takeaways. Thank you for that.
Okay.
So another thing that we think about, when you're thinking about sleep, is creating a sleep conducive environment.
Sure.
Do you have any recommendations about what we should all be doing before we go to sleep to help?
Sure. Yes, absolutely. In terms of it's definitely really good to have a wind down routine if possible. So there's something that we call in CBTI, we call it slightly cheesy term, it's called the buffer zone. So we recommend to give yourself, say, somewhere between an hour to an hour and a half before going to bed. You don't need to be too rigid about the exact period, how long. But the first thing that's good to do is to perhaps either have a warm bath or a shower. And the reason for that is that, when you first are in the bath or shower, that increases our core body temperature, but it's what happens after that that's important. So after that, there's a drop in the core body temperature. And when that drops, that actually triggers the release of melatonin, our sleepy hormone. So that's, a really good thing to do. And another good thing to do, a good thing in relation to that, is that by being in the shower or the bath, we can't be, well, presumably we're not on our phones. And that just means we kind of, perhaps it might be the first chance we have, maybe all day when we're so busy, to kind of be alone with our thoughts and to process our thoughts. Otherwise, we might only get that chance when our head hits the pillow. But by bringing that forward at that time, it means we're kind of dealing with all that stuff in our mind then, rather than when we are first trying to fall asleep or even in the middle of the night. A second thing is it is good to dim the lights to help get that melatonin going. Another really good thing to do, especially for, say those high achievers, people who are very busy, is to basically just write things down. So just grab any piece of paper and a pen and just write down whatever is on your mind. It doesn't have to be anything complicated. Just put things down, whatever is on your mind. And another thing we recommend kind of as part of that is to actually to write down what were the good things that happened for you during the day. And it can be as small and silly as you like. It could be at an amazing cake somewhere or something like that. It really doesn't have to be a big thing. Anything small is really good, because that helps to bring down that hyper arousal by shifting our mindset in that way as well. And then the final thing to do we recommend is just very simply, as we put it, going on holiday. And by that, we simply mean just doing whatever it is you find relaxing and enjoyable until you feel sleepy, and at that point to go to bed. So that can be anything like, watching Netflix, listening to podcasts, whatever it is that you enjoy doing. And we kind of underline the enjoy part, because when you're enjoying it, then that's going to be kind of more consuming your thoughts rather than any anxious thoughts creeping in about sleep. So, and it becomes a pleasant experience, because a lot of people with sleep issues end up dreading going to bed, and they really feel such an apprehension in the evening time. So anything you can find to do that you just love doing, that you look forward to, that's really the best thing of all.
Yeah, wonderful tips and advice. Thank you. Moving in a slightly different tangent, if we're thinking about that mindset of someone you would typically help in your clinic, would you mind talking briefly through a case study of how someone might present in their mindset when you first see them, and then what they're like after they've started utilising these types of tools and tips, please?
Absolutely, yes. One person that has, so many of my clients, stay with me afterwards and everything. But one striking situation was, there was a young gentleman who came to my clinic in Cambridge, and he was a young guy, very sporty and everything. But when he came in and sat down, and my approach is always very much to very simply, listen to the person, and I don't try to jump in or anything like that, and to really provide a compassionate ear. I think it's so important to really validate the person's experience. I feel really strongly about that. But as that was happening, he started to, I go through an assessment and take a history of the kind of background in terms of the sleep issue. But this gentleman, he, this really strong, tough guy, the poor man, he actually got incredibly emotional, and he began sobbing. And he was sobbing. I was, to be honest, I wasn't fully expected, but he was sobbing, the poor man. And it was to an extent that, because he was such a big man and sobbing, the walls of the clinic were actually shaking,
Oh.
and I felt my heart went out to him. I
Mm.
really, as I feel for all of my clients, but when you see a strong man cry, there's something
Mm.
almost kind of specifically striking about that in a way.
Mm.
Anyway, he went back to what he was speaking about, and he had a huge anxiety about his sleep and how it was affecting his life, and he felt it was very much linked to childhood trauma and everything. But as we then, proceeded with the course, I could see as time went on, one thing is that it's something I often notice my clients, I can almost see it in their faces over time. I can see more confidence in their faces because it's like they feel that they're not in the grip of this anymore. They feel that there's actually hope ahead and that they have support as well through it, rather than just battling it all on their own. But by the time he had finished, it was so amazing to his whole demeanor. He was like a different person. He was just kind of radiating sheer joy and looking forward to his future, his future ahead with his girlfriend, just starting off in life, their life together. And but really to see, I think he really felt like, first of all, that he was just purely listened to, but also to know that he then had the tools at his disposal. He knew how to deal with it, and he could use this at any point in the future if anything ever cropped up again. But I think just really that sense of empowerment that he felt, that he could, address this, and he didn't need to have this as such a huge weight in his life anymore. But yeah, it was such a contrast that will, particularly stay with me.
Oh, that's just wonderful. And what a difference having a good night's sleep can make.
Oh, completely.
In terms of
Completely.
confidence, in terms of positivity, in terms of
Absolutely.
concentration.
I
Just
know.
wonderful. I
Absolutely.
I think we're going to sort of tie things up now. I could talk with
Sure.
you all day. There's so much more
Sure.
to talk about. Thank you so much
Absolutely.
for today. Just
Amazing.
lastly, for our listeners, if you were to recommend a book, what would it be and why?
Oh yes, I think the key one I'd recommend, and I know this is the one that's always recommended in any of the insomnia clinics, is by Professor Colin Espy. So I can put up the link. It's called Overcoming Insomnia. Professor Espy, he does have a brand new edition of it as well, but the first edition is basically the same gist, but it really delves into some similar concepts that I spoke about today. And he's kind of known as the godfather of CBTI and sleep medicine in the UK. But yeah, that's a fantastic book. It's a kind of from a self-help kind of point of view of the user experience, so from a patient experience. So I think that's a particularly good one. Another excellent one that I think is wonderful is called Hello Sleep by Dr. Jade Wu. So she's based in the US. She's a board certified sleep physician, and that's a really, really excellent book as well. It's probably kind of bigger, there's perhaps more detail in it than the other one. But yeah, both of those books actually I think are fantastic.
They sound great, and definitely will check them out. Well, thank you again for your time, Dr. Michelle.
Thank you, Catherine. Lovely to speak to you.
And you. It's been wonderful to have you here. Take care.
Thank you. Thank you. Thank you, Catherine. Take care.
Thank you for tuning into the Mindset Exchange podcast. If you want to continue the conversation or share your takeaways, I'd love to hear from you. Comment here or head on over to my Instagram page at Katherine Ashmore __, where you can find me. The link is in the blurb. Let me know your favourite part and the feedback you have. I can't wait to hear from you. And in the meantime, hit subscribe so you never miss an episode.